Hi, my name's Lloyd Levine.
And my name is Rachel Strassman. And this is
Policy Chats.
Policy Chats is the official podcast of the School of Public Policy at the University of California, Riverside. Policy Chats is our student-produced podcast series where we bring in guests to discuss potential solutions to today's biggest societal challenges through the lens of public policy. While my classmates and I are the usual hosts,
for the next 11 weeks, I will be guest hosting a special series on the intersection of technology and government. This podcast series, sponsored by the Wall Street Journal Higher Education Fund, is based on my recent book, Technology versus Government: The Irresistible Force Meets the Immovable Object. This series explores different aspects of the challenges facing governments as they try to keep pace with the rapidly evolving technology landscape. We will try to understand why it is that government struggles to purchase and integrate modern technologies. We will explore the problems resulting from that technology lag and try to understand the future implications if government does not change its approach to technology integration. The episodes track with the sections and chapters in the book, with a focus on the problems, the people, and the future. Welcome to Policy Chats. My name's Lloyd Levine. I am the guest host of this podcast for an 11-episode run. This is we're going to be discussing today, Chapter 4 of this book, the book that I wrote along with a number of colleagues, Technology versus Government: The Irresistible Force Meets the Immovable Object. Hopefully you have had a chance to join us for the prior episodes. These are standalone episodes, although they do build on each other. Today, I am joined by three guests in no particular order. Dinara Godegay, a wonderful, amazing policy student at the UC Riverside School of Public Policy, going to bring a perspective from somebody of Generation T, which is a concept that we talk about in this chapter and have talked about before on this podcast. Juliana Trammel, who co-wrote the chapter with me, and Laura Robinson, who co-wrote the chapter with me and Juliana. So the four of us are going to have a lovely conversation. As always, this is not a summary of the chapter. This is going to be really a launching point, utilizing the chapter as a beginning of a discussion that works with the book. So this is not a substitute for reading the book. Before I begin this episode, I want to dedicate today's episode to my cousin, Barry Wellman, professor of sociology and technology sociology at the University of Toronto. Barry passed away this week, and his funeral service was today. Laura was one of his students. Barry introduced Laura and I, and if it weren't for Barry, I would never have met Laura. I would not have written this book, and I wouldn't be here today. Additionally, as I said in his eulogy, Barry entered my life when I was 5 years old, and I don't remember a time before when Barry Wellman was not in my life. And I have so much to be grateful for him. I will miss his love, support, friendship, advice, counsel, and I will miss seeing him. Barry, this episode is for you. So with that, Chapter 4 begins the second section of the book. The second section of the book is really a focus on the people. And for me, one of my flaws with technology and government, books on technology and government that I've seen is really it's a focus on the technology, period. But as somebody who comes from the world of government, hopefully those of you who've been listening know I used to be a member of the state legislature here in California. And so, spent many years working for the government. I'm not just approaching this as an outsider trying to tell the government what they should do. That's normally the perspective these types of books take is people from the outside, technologists either criticizing the government without understanding it or really just focusing on the technology. But the technology, as we talk about in the book, is for the people. It's to make the government operate in a better way for people. And so this chapter begins that conversation. Really, the chapter uses the COVID pandemic and Twitter. And by the way, as an aside, and we put this as a disclaimer in the chapter, we're going to continue to refer to it as Twitter. It was Twitter when this chapter was written. It's easier for a conversation to call it Twitter. We do understand that it is now technically called X, although the website is still twitter.com. So we're just going to call it Twitter for the purpose of this conversation. While we use Twitter and the CDC and the pandemic as the case study, really to extrapolate from there, the bigger issue is, as Laura and I started collaborating on this chapter before Juliana joined us, the idea was the Matthew effect, which was really a compendium, a taxonomy of all different government services that are available to people who are, disadvantaged, might be on the wrong side of the digital divide, wrong side of the economic divide. What are the services that are available to them that they are missing out on or have a harder time accessing because they don't have technology, because the benefits that are aimed for them are delivered in a way that is inaccessible to them? So that's really the perspective we're going to take. We'll discuss the CDC and Twitter, but really we're going to discuss e-government and e-government service. So as always, I'm going to turn it over to my co-authors and ask them to start by just summarizing the chapter a little bit, kind of what the chapter talks about, how we did it, and then we'll launch into a robust dialogue from there. So Laura, why don't you start with your part, and then we'll go from there.
Thank you so much, Lloyd, and thank you to the UC Riverside School of Public Policy for having us and sponsoring this fabulous series. Thank you to Dinar for being here, and it's really a pleasure to be with everybody today. So our chapter, we're really trying to balance forces that have to work together for optimal outcomes, and these would be e-government.
To interrupt off the top right away, we didn't introduce your university and where you're from, so why don't you and Juliana do the same thing? Why don't you introduce yourself a little bit more than I just did, other than just the co-author of this chapter? Before you do that, I apologize for the interruption.
Oh, no problem. So my name is Laura Robinson. I'm a professor of sociology at Santa Clara University. My areas of expertise are digital inequalities, such as Lloyd just mentioned, and I'm also a Brazilianist. I have several degrees from French University. So I study French, Brazilian, and American use of digital technologies, both in terms of elites for policy and discourse, and the digital divide or digital inequality. So that's me. All right. So all of these things are kind of wrapped into my work with Juliana and Lloyd. And what we're trying to balance is how e-government can use social media, which is privately owned, and try and approach the needs of many different populations, keeping in mind the digital divide and, of course, generational differences in attitudes to technology. So I'm looking forward to what Dinar has to say about Gen Tech as well. And we're using as our case study the CDC and the COVID pandemic. So I think what we saw in the pandemic was how so many governments, turned to social media, turned to the internet, but there was a baseline assumption that everyone had access to it. And when we often think of e-government, we think of, okay, the digital delivery of government services to recipients, okay? What we don't think about is how then those things leapfrog or spiral out because of private actors using other communication channels. So I think that's what we're sort of interested in as a case study to see what could happen in the future. So we looked at how the CDC used their Twitter or X account and how they disseminated information essential to promote a citizen-centered, access to government information on this medical crisis. And one of the really interesting things that we saw that I know Juliana is going to cover more is the benefits were not equally accrued by all populations. Again, the Matthew effect, what Lloyd has been talking about, and also the dependence on other social actors to relay these messages. And something that we saw that I think is so interesting is the effects of economic class, race and ethnicity, all of these different things that are part of digital inequality about who was actually following the CDC, but who was relaying those messages second and third hand. And Juliana's done this really fabulous analysis of networks and visuals that she's going to talk to you about. But that's the really interesting thing to me is this leapfrogging, like how does the message get out there from government? And then how can government better partner, for better dissemination of public health information? So those are kind of our key concerns. And one of the things that we touch on are literacy gaps, which are part of the digital divide. So it's not just for those of you who aren't familiar with digital inequalities, it's not just having access to the equipment, to the network, but it's also having the ability to find information, evaluate it, and then deploy it effectively for all life facets. And certainly, public health emergencies are one of them. And we can actually see all these things right now with the heat wave in the US, all of the cooling centers. The people who are most likely to need those cooling centers are probably the people who are least likely to have a cell phone and the ability to use that cell phone, find the cooling center, get the directions to the cooling center, et cetera. So you can see how these things spiral. Some other populations I think that as we talk about the government, we're really going to want to keep in mind are the socially isolated, older adults, penal system subjects, digitally advantaged students, gig workers, last mile workers, all of the people that are part of this incredibly complex chain of actors and services that actually are fully dependent on one another in using government services. And what we can see in all of these things is, again, there's this Matthew effect. And as Lloyd explained, it's a social science concept, which is, those with more access to resources will have those resources to have a more abundance of resources, and those who have fewer will have fewer and fewer. So I think that'll be a really interesting point in some of our discussion. And I'm going to turn it over to Juliana.
Thank you, Laura. Thank you, Lloyd, for the invitation. I'm Juliana Trammel. I am a professor of mass communications at Savannah State University. I'm also the chair of the program. And my role was to look at the communication structure when it came to COVID, when it came to the CDC, and how the information flowed. Particularly, I was looking at how the information was being deployed to marginalized populations. And initially, we looked at two spheres. We looked at the website, and we also looked at Twitter flow. And starting with the website analysis, we did see an effort to reach out to different populations. For example, there were some videos that were disseminated in Spanish. There were some, I don't believe there were other languages. It was primarily Spanish. Now, when it comes to Twitter, it was very interesting because when we think of social media, we think as an opportunity to engage because social media is accessible to many people. If you have access to internet, most would have access to social media. And when we saw the information flow from CDC to populations through Twitter, it was interesting because people were talking about coronavirus. And if you can visualize, once you reach the chapter, you'll be able to see images. And when you see the information flow on Twitter, the information would flow in clusters. And so the information was going, but instead of just going directly to people, what we saw is information being somehow digested in clusters. And these clusters were led by influential people, which is very similar to the two-step flow of traditional media. Decades ago, we believed that in order for communication to go out to the masses, particularly in development, you had to go through key leaders and then you go down to the population. And it's interesting because social media will think that it's accessible to many, but when you start studying the structure, you'll see that the flow is still formed in a sense of, in a form of elite. And the marginalized voices are still at the margins of that communication structure. So I think that was very interesting. I think that it was effective in terms of getting the information out. And if you observe the diagram of information, we see that at the bottom, we see voices that are totally isolated from the key communication. So you see those bigger clusters of people talking. And by the way, with NodeXL, we use NodeXL as the method to analyze the information flow. And contrary to how many look at social media, they say, or how many people, how many likes, or how many followers. With NodeXL, it's not so much how many, but it's the how. It's how the information is reaching others. And so with NodeXL, we're able to see these big old clusters. And in some instances, those clusters were interconnected. In some instances, they were totally isolated. But even outside those clusters, we saw those individual voices that were totally disconnected from the main communication. So although I think CDC did a decent job in terms of trying to get the information out, I think one, they had the dependency on other key leaders to then disseminate information to their constituents. But also, I think there was a disconnect between key messages from the CDC and those voices that were isolated. They fell right outside other clusters that had key influencers leading the conversations around coronavirus and COVID.
So Before we go on, I figured anybody who's listening at this point is probably saying, well, wait a minute, you missed something. And what they're probably thinking we missed is the quality of information. Twitter was also excellent at disseminating misinformation, but that wasn't the point of the chapter. And we actually put a note at the end of the chapter saying just that. The point of this chapter is to look at the technology as it was intended to be used as an effective way of communicating important messages, not the battle and tension between misinformation, disinformation, accurate information, but just assuming if everything operated as intended, and there were no misinformation and disinformation, there still would have been problems because of the technology. And this chapter actually follows chapter 3 because obviously 4 follows 3, but specifically because 3 in a different way also looks at a similar concept. In that regard, we discussed in chapter 3, in our podcast on chapter 3, a policy failure that resulted in marginalized communities suffering during a natural disaster, a dam failure, literally the failure of a dam in San Jose, California. And here we're looking at if the best case happened, if the government utilized this technology in the way it was intended to be used, which they tried, there were still failures. And so with those failures, what then, we can look at it in this case, but let's say, we've got Dinara on, is there FAFSA failures? Is there a communication? And we discussed that in the first episode with Jen Palka. FAFSA is, obviously very important financial aid tool. Are there failures around ability to obtain information or even just obtain access? And you can go down all of the lists. Before we go on to the dialogue, I also want to stipulate a couple of other things in here. One that's I think very important, and we've discussed it in the book in a couple of chapters, and we've discussed it in other podcasts in this series. We'll discuss it in future ones as well. And that is something that both Laura and Juliana touched on. The U.S. Census Bureau has excellent data that shows that the group of people who utilize government services the most are the most vulnerable. The more well-to-do, and that's not rocket science, the more well-to-do, the less likely you are to need to engage. And California, has done a great job. I'll use California as an example, has done an amazing job of creating programs to help low-income individuals, help seniors, help people with permanent disabilities. There's a whole host of programs out there. California's done a terrible job, as most states have, of connecting people to those programs. And so, there's a gap there. But what's also interesting is as the state is transitioning to e-government services, if you look at other data, if you look at data from the Pew Center, and if you look at data from the California Emerging Technology Fund, and we discussed this, what you see is the same group of people who are utilizing government services at the highest rate are also the ones who are least likely to have what we call meaningful internet access. And that actually is a term I was going to get to, so it's a good segue. As we're kind of going through a couple of definitions here, I want to define two more quick ones. As we're discussing this and we're looking at what Laura talked about, the access to the information and the digital literacy skills, we're looking at a population who's lacking one of 3 things. And it's a definition I coined in a paper in 2018, and that's meaningful internet access. And it's a 3-part test. And I kind of came up with it as a former policymaker trying to figure out, well, if people want to close the digital divide, it's all well and good to sit around and say, well, we need to close the digital divide. But what does that actually mean? If you're going to try and convince a policymaker to take action, you need to give them some specific objectives other than we want you to close the digital divide. And so what I said is they need to work to provide citizens with meaningful internet access. Broadband is an enabling technology. So if you have broadband to your house and you don't have a computing device, you don't really have much. So it's a broadband connection capable of meeting the needs of the day, the speed sufficient to meet those needs. It's a computing device that has the same ability, meeting the needs of the day. And that may not just be a phone. It may be a phone, but it may be a QWERTY keyboard. If you're trying to apply for a job, doing resumes, most online job applications still aren't mobile optimized. So, a lot of people say, oh, well, they've got a smartphone. it may not be a smartphone. A smartphone may be insufficient. And then digital literacy skills. And that's really important. And digital literacy skills take a lot of forms. If Dinara has never used the internet and I'm like, hey, I got your internet access, go ahead. Well, in 2024, the internet is kind of an overwhelming place if you don't know how to use it. So go find yourself some benefits is not really useful. So it's a 3-part test. It's the speed necessary, it's the community device, and it's the digital literacy skills. And so the last thing I want to definition I want to get out of the way for our going forward, also straight from our chapter here, and we use the Organization of American States definition here of what is e-government. And we kind of know it. It's not, you don't need a precise definition, but it's the application of information and communication technologies to governmental functions. And I would actually add, and I think we do, quasi-governmental functions like healthcare institutions that may not be governmental, your utility company, governmental and quasi-governmental functions and procedures to increase efficiency, transparency, and citizen participation. So, are you able to access the benefits to which you are entitled? And so let's use what we've just talked about as a launching point to think about future implications, not just about, Twitter and the CDC and how it went, but the implications of the problems that we identified as we're now looking going forward. And, and the title of the book was chosen on purpose. Technology has run over virtually every other industry in America. Government is technically, the last industry really standing that hasn't been transformed. And Dinara is here for a very specific reason. Dinara is what a member of what we call Generation T. We define it in the book as really those people born in 2002 and later. And why are they Generation T? They're Generation T because it's the technology generation. It's the first generation in America, and to a degree in the world, although other countries do lag behind. It's the first generation that has been born completely enveloped in a technology bubble. I'm not going to put Dinara on the spot because that's not kind to guests, but generally speaking, those born in 2002 and later will not remember a time before broadband to the home. With the exception of low-income households and rural households, broadband was first deployed to homes in 2000 and reached 70% penetration by 2010. So, if you were born in 2002, you were 8 years old in 2010. You might remember a time where you didn't have broadband if yours was one of the last adopters, but the odds are you won't. And certainly beyond 2002, you're not going to remember that. The iPhone came out in 2007. You're 5 when it came out. You don't remember a time, and it was so popular, everybody had it. And then the Samsung, which is the next most popular phone, came out in 2011. So again, you're not likely to remember a time before technology was everywhere. And this group is this Generation T is digital natives. I guarantee you that if Dinara wants to do something with her friends, she texts them. Whereas I had to pick up the phone and call or go knock on a door. If you wanted to make a restaurant reservation, and these are some mundane things, you look through the phone book, you dial the number. Now you use an app for that. To say there's an app for that. There's an app for everything. And so, Dinara, why don't you start as a member of Generation T by kind of talking to us about how you just generally engage with the world through technology. Am I wrong? And you're free to say I am, about the prevalence of technology in your life. And then from there, I'd love to hear your thoughts on how you envision interacting with government when you get to be out of school, working, everything that you would have to do. How do you envision them technologically currently, as much as you may envision them if you do it all? Just kind of, I'm not going to ask you a specific question. I'm giving you an opportunity to talk here. Go ahead.
Thank you. Thank you so much for having me and for introducing me. Of course. So just to kind of start off with using technology, I have to agree. I definitely do not remember a time before I had access to at least something. I will say though, when I was younger, my parents did wait a little bit until I got my own cell phone. So I did have to use my landline to call my friends when I was in middle school. So there was that. But definitely now everything is through my phone, whether it's like I have an iPhone, so either iMessages or any other social media platform. It's so easy. I'm currently in DC and I go to school in California. So being able to contact my friends is one simple message away rather than having to mail something. And trying to contact them and taking the time for that to mail and then hear back from them, or even sending a like email, which even that's like a digital thing. So definitely it's a big part of my life. I feel like also for others who are in kind of my age range, it's also like a form of self-expression, having the chance to use social media and use that as a different method of expressing yourself, like especially if you see like Instagram or even Twitter where you get to share your thoughts. It's like another self like form of like art. It's another kind of art form in that sense. So I feel like it's kind of shaped how we are as people in that sense as well. Um,
Before you go on, let me ask you two questions. So what you just said inspired two questions in me. One is, and I'm going to ask them at the same time. You can answer them in order.
mhm.
How much do you use applications on your phone, apps, the phone in general, or your computer to engage with the campus? And doing all of the things from the administration to everything else related to the campus. Is it easy? Is it hard? And specifically, also compare that to your navigating private life. I've used the example in the past of, because it happened virtually at the same time, of an Amazon purchase that I was able to make while I was flying from here, I think, to DC or New York. And I was literally like, I'm 35,000 feet in the air over Kansas, with my computer connected to the plane's internet, and I ordered it, and I either had it delivered to my hotel because I needed it there. And then at the same time, I was trying to get my wife's carpool stickers for her electric car. And navigating the process where I had to go to the Department of Motor Vehicles website, fill out a quasi-online form. It was really more of a writable PDF than true online form. Then print that out, sign it, date it, and enclose a check and mail it off. And 6 weeks later, I had my carpool stickers. I mean, there's a huge difference there. And as Jen Polka and I discussed on the first episode, a lot of policymakers, their impression of technology is not formed by their interactions with government. It's formed because if you are a policymaker, the legislature generally has pretty good technologies involved. Your perception of the prevailing technology of the day is your interactions on the private side. You're not aware of the things that are involved in keeping the unemployment insurance, systems and databases up and running. So I'd love to hear how you view the campus technology and your engagement with campus as you contrast that with your private life. And then I didn't ask the second question, so I'll come to that in a second.
Okay, for sure. Like at least as like a college student, using technology is basically everything. I feel like being at UCR, we're very, very, very lucky to have a library that provides laptops so you can check out like a book. So for students, I really truly cannot imagine going through college and not having a laptop or at least some like technological device, because not only do we access course material online, everything's run through the program Canvas. So to be able to access any sort of assignment, take quizzes, exams, all of that is online. And I wouldn't imagine being able to do it any other way, because that's usually how it is. And any like written assignment, automatically using Google Docs, sitting on my laptop typing it. So definitely it's basically the same, I think, as like a private, or like my private use of technology is. It's I'm sending emails to all my professors, like,
What about like paying fees, obtaining interactions? That I actually had to
um,
literally, when I was in college, and I'm dating myself here, I had to get my transcript physically mailed. My friend applied to grad school at UC Riverside as an undergrad. He had to carry the transcripts from the paper transcripts up. Has the university met your expectations when it comes to technology?
I would say yes. I can download my PDF and I can get, or my transcript, sorry, as a PDF, either like an unofficial one, and even the official one, you have to like request it, but it doesn't take more than a couple hours to get an official transcript ready in a PDF version. And then paying tuition is also through a like, everything's like in a portal called RWeb, and you can just like access either your student account to like access class schedules and even like scheduling classes. My one thing is that like scheduling classes is one of the most um tense things to do as a college student, is like like any bandwidth that you have going into that completely dissipates the moment you need to pick classes, because there's always so many people who are on at the same time. So I will say that is something that I think is like a little bit below my expectations, but in every other way possible, it's definitely met where I think it needs to be. We use it in basically everything. Every component of being in college is online. And I feel like it's improved a lot since COVID, since a lot of classes had to be online. There was no other option. So I think from then forward, it's been even better than it was before. But even throughout, like, I would say high school especially, it's definitely been like online. Like since I think I was in 7th grade, my school had given us Chromebooks to use. And before then we had like computer labs at the school. So in those ways, yeah, I think I've just like always been around it, and
Mhm.
it's pretty much met expectations.
Truth, accuracy, fairness, curiosity. These are the pillars of journalism and of higher education. At the Wall Street Journal, we pride ourselves on being a trusted and essential resource. The Wall Street Journal is partnered with the University of California, Riverside to provide your campus an unparalleled access to essentials to be prepared academically, professionally, and personally. Students get full access to WSJ News, curated newsletters, challenges, podcasts, and documentary series to help stay up to date. Activate your school-sponsored subscription today at wsj.com/UC Riverside.
That's good. It's good to hear. I wonder if partially that's because the university caters to young people, whereas some of the others are, less nimble, and some of the other departments and agencies of the state are less nimble and less able to make those changes. And I'm glad to hear that they've gone away from computer labs and are really distributing Chromebooks, because as Laura and I have discussed ad nauseum over the years, there's still a difference. If my kid has access to a computer at home and your kid is dependent upon Starbucks hours or library hours, my kid can be working much further into the night than your kid can, and that's a huge disparity. And and Laura's written a paper on exactly that as it relates to performance in the classrooms. Laura, let me shift back to you here a little bit. As we're looking kind of at what we talked about, in the paper, what are some of the other areas moving forward where you can see some of these the digital exclusion challenges really inhibiting some of the populations that you talked about in your opening, where your research is focused? Maybe not. I'm going to ask you to do something professors usually hate to do. I'm not going to ask you to draw on research, but I'm going to ask you to use your expertise to prognosticate for future implications.
Well, thank you, Lloyd. And I will take my thoughts from my watching of some Obama videos with Wired magazine last night. As I was thinking of ideas for this, I thought, okay, let's go into the past. Let's see what President Obama thought that, he was going to do, because he was the president who started, I believe, correct me if I'm wrong, ushering in a lot of this technology. And some of the tensions that he brought up, and I am answering your question, I thought, let's think about all of the services that government can provide. I thought that's one layer. But then the other layer is the information that we're going to have to give to government to effectively get all those services. And that's where I think we see a lot of tension. So we have a digital inequality tension. And I think one of the things that digital inequality scholars need to understand more is an aspect of digital literacy is control of your information, knowing who has your information, knowing how that information will be used. So I was just thinking, actually, I was so happy to hear that you're satisfied with your education, but are you aware that professors, at least with my course interface software, we can see when you've logged on, how long you've spent on the website. They even have eyeball trackers to see how much of the online readings you've read. And most of my students were not, and I come from a university, it's very, very digitally resourced. They were not aware of there's a trade-off for all these services, and it's literally being filmed, being tracked, giving, access to the camera. So many of students that I know at other universities are filmed during exams if they're remote, et cetera. But back to Lloyd's thing, what are some of the ways where we can receive services by essentially letting the government into our home? I just got my new passport, took all my photos at home. Making my DMV appointments at home, as Lloyd said, getting new license plates, getting vanity plates for my car, right? Getting record keeping, birth, marriage, death certificates. Every time we access these sites, I think it's really important to know the government can access where you are, the browser you're using, and a lot of other information about you. Now, I'm happy to make that trade-off, but I do think it's worth thinking about, right? Obviously, some other areas are paying taxes, getting permits, which might not seem like a big deal the minute you own a home. It's a big deal. Urban planning, transportation. I was speaking to somebody last week and they said, oh, have you heard about how UC Irvine has said they're not going to put print schedules for public transportation anymore? Well, I think everyone on this panel knows where we're going with this. And they said, they're pushing this idea that it's so great, you can just use your phone to plan all your transport. And I thought, what year are we in? Elites who are planning all this stuff are not taking the bus. If they were taking the bus and had a flip phone, they probably would still understand that you need that print stuff. Also, I think there's a lot of work to be done about disabilities and implicit ableism and the assumption that everyone can use a smartphone. So there are all of these, I think, there's an assumption about who the target audience is. And I'm not saying it's wrong, but I'm saying it's incomplete. So other things, our court system up here in my county, they're now allowing remote court appearances, which I think is great. But you can think of all these other things. You brought up banking and finances. I think that's really important. Another one I think is really, really important is politics. And here's another one where I think that tension between we've got to give government information to use the services, but then we can get a lot, is how are we going to handle voting? Are we ever going to have voting at home? How could that be manipulated, et cetera? And I think we're seeing some very interesting things happen in the UK and France right now with the youth vote and how it's using technology to engage in these processes. So I would actually like to circle back to a question. How many of us during the pandemic, was it our gut response to go to the CDC to get medical information? Or did we get it somewhere else? Or did we hear about CDC from a private influencer and then go check the CDC as a second instinct? Does that make sense?
Sure.
So,
I did my own research. Sorry, I couldn't resist the mantra of so many people. I did my own research. No, you did a Google search. There's a difference. No, that's a great question. Being the good researcher I am, I used multiple sources, CDC among the trusted sources. But I didn't wait for it to be pushed to me. When I decided that I wanted to get an update or know something, I proactively went to CDC. The New York Times was an excellent source of information during the pandemic on COVID numbers and other things. And so there was a few that I specifically reached out to. The county, if I wanted to know what the rules were in my county, the county website. But again, I mean, and I'm gonna kind of lead to something in a minute. But again, Laura, and I know I didn't give the others the chance to answer. Kind of you're setting up the obvious there. If you don't have access to technology, where are you getting your information? And if you don't have access to technology separate from the pandemic, how are you, in my mind, one of the things I greatly care about, how are you accessing your benefits? And so I'm going to now ask Juliana the question here. As a communication specialist, as I said a few minutes ago, California does a great job of creating programs for low-income individuals. We're probably one of the best states in the country at recognizing that there are vulnerable populations out there who need assistance. But I was probably just as guilty as the next of not understanding at the time, I've certainly come to realize it now, that our methods of connecting people to those benefits were at best shoddy and antiquated, at worst non-existent. So how do you connect people to information whether, providing people information, how do you overcome the digital divide? And I mean, think expansively. I mean, if you've got some sort of magic idea, go with that. How do you overcome that as we go forward, as government hopefully tries to become more and more digitally literate, and seeks to avoid what I seem to have noticed a little bit, and I understand it's a sample size of one, although Laura and I did have a discussion about it, so it's a sample size of one plus hearsay, where I went to the post office, and I noticed by observation, the people at the post office seem to be all or almost all lower income folks who didn't have access to postage and some of these services at home, or potentially weren't able to pay bills, do things online. And I noticed the same thing. I've had to go to the DMV a couple of times recently, and I noticed again the preponderance of people at the DMV were much lower income, often spoke Spanish as a first language, and so is government creating a caste system where those of us who have access to technology are able to access the benefits of online government, as you can access the benefits of online everything else, and everybody else has to go in person. And I know this isn't your area of expertise, but from my standpoint as a government person, there's huge cost implications for that. In addition to everything else, access to resources becomes inefficiently distributed. We're now spending lots of money to keep brick and mortar open for a dwindling population. Service diminishes because there's fewer people coming in, there's fewer need. So given all of that, how would you communicate benefits to and not just communicate, connect people with the benefits that they're entitled to?
I'll get to the communication flow later, but first let me talk about access to services. I think when we talk about digital divide and what has happened since the early 2000s, we think we got to the promised land. People have access to mobile phone, they have access to broadband internet. But one thing that I think is a challenge is that communication flow or access to information does not always lead to a delivery of service. In other words, most of the information on websites, they are very linear. You see the information, but they are not transactional. I think that moving forward, I think service is not transactional. For example, as Laura mentioned earlier, there are several instances, even now passports, it can be done online. But a lot of there's an assumption that information dissemination leads to behavioral change, and it doesn't. Sometimes it takes more than just telling someone what is happening. And I think I do hope that government will expand this notion of being more transactional, even going back to the point earlier, having access to services in education. And that made me think, are people's personalities or the culture we live in, is that what is changing technology, or is technology changing people and how people carry on with their lives? And I think regardless of the answer, we can all agree that we are living in a very transactional society. Instead of mailing information to California, is even faster to text instead of even sending an email, because we are living in this very fast-paced society. So I think that eventually government has to catch up in that sense and become more transactional. Now, when it comes to reaching to marginalized populations, what we see, especially social media, is that as I mentioned earlier, even though social media gives us this notion of we have access, what is happening also is that we are creating clusters, and in those clusters we see layers of marginalization. So even when government is disseminating information, let's assume that information will help upper mobility for some, but if the flow is not reaching marginalized groups, they are not still being accessible to them. So I think government has to understand the structures of communication flow, not just assume that once they are talking, they have achieved that goal. I think that somehow social media is creating another level of marginalization instead of promising or giving us what was the promise. The promise was once we fill the gap with the hardware of technology, we would be in a position of perhaps more equality among folks. No, now we have this another level of exclusion. Even with AI, we now started to see how AI is creating another level of a marginalization. So I think to answer your question in terms of reaching out, I think understanding those structures will help. It's not just speaking or disseminating information. It's very important to understand the structures of the information flow and to ensure that think of a tree with roots, as it goes, it cannot just be one straight going ahead and hitting that goal. You have to be able to exit the highway and go to communities, thinking of like information highway. And I think that would have to get those marginalized closed groups that might not be they might be talking, they might be online or live, but they might not be in the flow of information that could provide them upper mobility.
Yeah, no, I mean, as you kind of go back to the basics of communication 101. Communication is a sender and a receiver. Otherwise you're just yelling into the wind. And so I do think, and there's differences as you showed in some of your graphs about where messages originate and the receivers, but I think there is that misimpression of government that everybody is listening, but that's also not unique to government. YouTube, Twitter, Facebook, they've given everybody proverbially a microphone, but that doesn't necessarily mean they have an audience. But I don't think people distinguish that. Well, I said it. I sent an email. Yeah. Do you know how many emails I get every day? Just because you sent an email doesn't mean they read your email. And I think that is certainly a point that's well taken and needs to be considered, that just because you say something or broadcast something or put something on Twitter, especially in today's disaggregated media, world, it doesn't necessarily mean somebody received it, understood it, or acted on it. And I think that's important as well. Let me go back to Dinara for a second here. So so it sounds like throughout your schooling, and even at Riverside, the university and your high school distributed Chromebooks. I know my kids, they're one's in middle school, one's in elementary school. They have Chromebooks from the school. Your schools have distributed Chromebooks as well. That's correct?
Yes, yeah. Through starting in about 7th grade and then up until high school, senior year of high school.
And UCR distributes computers as well to students?
It's like a service they have at the libraries where you can use your student ID and check it out like a library book. So you can rent it for 24 hours and return it and then just check out another one if you want. And they have a variety of laptops, not specifically one kind.
So are there students on campus who may not have a computer, that is their own? Or at least that there's, my kids' Chromebooks aren't theirs, but they get to keep it for the school year. They don't have to check it out every 24 hours.
I'm honestly not sure if there are services to keep it for the full year, because that is how I had my Chromebooks when I was in high school and middle school. Right. But I think UCR is the school that advocates for having a lot of first generation or I think it's second in the US for social mobility. So I think or for promoting social mobility. I think there are some students who may not have their personal laptops, but the libraries are quite open to adjusting things. And I think there's a lot of resources that UCR has that I'm sure there are options to have a university provided device in some manner to have longer than 24 hours. I'm just not really aware of all the details.
Can I offer some thought here really fast? Because I love what you're saying.
The whole point of this, Laura. So offer some thought. Want to hear it.
I think this is so important that we have a member of Gen Tech who is explaining the importance of resources being provided, but I want all of us to think about the cost. If you have enough money to be on campus and scoot to the library in your sweats, you're probably not as likely to need that computer. I am at a very resourced university, and I have students who do not have a computer at home and do not have the internet at home and don't even have a smartphone. They're rare, but they're out there. And you know what? Some of them are taking public transportation an hour and a half each way to get to campus. So this idea of going back every 24 hours, I can see from an elite perspective. Again, it's like, no problem. We've got a campus. The students can just come and go. I think what government needs to do is actually have people who don't have resources have a much more community-based discussion in these policy decisions, because all four of us, we have plentiful access to resources. So it seems easy to us. All of the struggle is invisible. And something I've said in my work over and over, you cannot see hunger until it is way down the line. You do not see the implications of digital disadvantage on young people until way down the line in major, major life decisions, education, career trajectory, good grades, everything else. These things are cumulative and invisible. And I think if I could give one message to government, it would be take a user-centered approach in creating local policy to serve populations locally. And I'm not a policymaker or a politician, so Lloyd, that might be more difficult than I'm aware of.
No,
But
it's actually that's an excellent suggestion. I think your impression of UC Riverside might be slightly off. Janara is correct. We have we're the number one, I believe, we're number one or two in the country in terms of first generation college students. It's not a bunch of affluent people bopping off to the library on a daily basis, to get a new computer. A lot of them, although UCs are generally not commuter schools because of where Riverside is, there are still a lot of students who do live with their parents, and not living on campus. I don't know that I've ever seen any demographic data, socioeconomic status of our students. I would argue that yes, what you've said about taking the bus, all of that is correct. I would argue it's a hardship to have to get a computer every 24 hours. That's a challenge in and of itself. But I'm also looking at, to me, we have, non-college students. The general population who might be trying to get their Medicare benefits, their Medi-Cal benefits, their, Cal Fresh food, access to food. You just mentioned that, we're not talking about, yes, there's hunger amongst college students and that's actually demonstrable, but I'm just talking about in the population at large accessing benefits. At least you have access to a device, but imagine if you had to go to the library to access your benefits. I've never done a complete taxonomy of all the benefits in the state. When I, a number of years ago, I was working on a project, and this is one of the things I first started realizing, oh my God, I'm guilty of. Like we pass these programs and we talk look at this program we passed, but if you're low income, and you're trying to access, your benefits, you've got to call your electric company, in many places, your water company, and each of them have low income programs. There's programs for low income electricity. There's multiple programs for low income electricity, by the way. You've got your telephone, your lifeline for your phone. You've got, food. If you've got a car, if you're fortunate enough to be able to have a car, you're probably going to have to use your, get low income car insurance. That's a multi-step process through the Department of Insurance and your local providers. And the list goes on and on and on of all of these benefits. Well, every benefit that I've just named requires multiple phone calls and probably, referrals to websites to obtain those benefits. And so, there's no streamlined process for connecting people to those benefits. So regardless, Juliana, of the communication challenges, there's also okay, I know about this benefit. Now, how do I go get it?
And that's the notion of communication being transactional. When communication is transactional, both receiver and the sender will benefit from that communication process. And so it's more than just having a button on the website or have a click here or submit here on the website is really, the question is it really effective? Are both parties being able to communicate effectively? And I hope the government will take the approach also moving forward.
I think there's some I'm going to kind of transition as we're winding down our time here. We've got about, I don't know, 10 or so minutes left. We don't have to stop exactly at an hour, but they're, generally right around an hour, to some concepts. So I don't remember who mentioned it earlier. I think it was Juliana, but I can't remember for sure. Yes, it was. You were talking about the CDC communications efforts only coming out in Spanish. I think that's an area where technology can help. There's a number of services. The first one that I was aware of might not be the first one out there. Google Translate was one of them. But there's now much more sophisticated versions of Google Translate. The Samsung, and again, I'm not touting Samsung. I just happened to do some research yesterday. The Samsung Galaxy S24 series has built-in AI that can translate. I think it was like 17 different languages. So now you're pulled over by a police officer and you speak Hmong, which is a commonly spoken language in the Central Valley of California. I'm not just finding some obscure language. There are huge Hmong populations in California. And you don't speak English. And the police officer who pulls you over speaks English. Maybe they speak English and Spanish. Well, now maybe there's a technology. Maybe if the police officers, maybe the person who's being pulled over doesn't have access to technology, but if we arm our police officers with technology devices, or taking it outside of being pulled over, if we arm the people who are there to provide benefits with the technology to speak multiple languages through technology interface, and not waiting to call a translator over, we need a translator. It'll be 2 hours before we get one here. And that can also overcome sign language as well. There's a number of ways that could help. I think that's potentially a benefit here. There's one thing I'd love to get all your reaction on this, and it kind of goes back to the question of, does the campus distribute devices? And yes, they do. So as people know, I work for T-Mobile for government. I see my job. I have a really cool job. Laura knows this. My job is essentially technology, gov tech strategy for T-Mobile. And so I joke that T-Mobile has hired me to do what I was doing anyway. I started working on this book long before I got to T-Mobile. It takes a long time to do a book. So I started this book, because I was passionate about this. And so essentially I get to help government understand how T-Mobile's technologies can transform them. And we're doing some cool things. And I'm only going to, maybe I just feel a little guilty. Like some of the things we're doing, we've helped fire agencies throughout the West reduce response time to wildfires because we have AI-powered cameras. So instead of relying on somebody to spot a fire and call it in, and by that time it might already be huge, these cameras are mounted way up high and they scan, and they are so sophisticated they can detect the difference between smoke and fog and smog and clouds, and they can work at night, and they reduce response time, which allows the fires to be put out much faster. There's a whole host of technologies that we have here at T-Mobile that are really, really interesting, that I find interesting, not because I work for T-Mobile, but because I spent 20 plus years doing all of these different things before I got to T-Mobile, and what I'm now working to help provide the solution. So there's one very specific one that I'm really interested in your thoughts on. I actually think it does, and by the way, it didn't exist when we started writing this chapter, Juliana, Laura. It wasn't there. We didn't have the ability to put it into this chapter. I probably could have gotten it in the last revisions, but I decided not to. It's called CPR3. CPR, life-saving, and it's connecting people to resources, which is life-saving, and it does it in 3 ways. And T-Mobile's actually got some substantial projects out there. What it really is the government. It's not T-Mobile. We work with a government partner, and the government provides a phone device to an end user. So it's not going to government employee, it's going to an end user. And it's not going to affluent end users. It's going to end users who are much more vulnerable. I'll give a couple of examples in a second here, and I want to hear your thoughts on this, all 3 of you, as a potential future solution, or also separate from this, what would your reaction be if I told you, well, the government is giving people, smartphones, which is essentially what they're doing. They're not giving them iPhone 15s, but they're giving them smartphones. The device, I mean, this is my personal phone, but essentially the device looks just like every normal phone, except it comes with unlimited hotspot data. So on a 5G network. Now, if you're not familiar with 5G, 5G is just a different way of getting people broadband. As I walk around, in cities, when I was down at UC Riverside on campus recently, I got over a gig speed just walking along, streaming on my phone. Up here in Sacramento, where I'm based, I get 750 megabits per second. I have home internet through T-Mobile. As I travel the country, I'm getting incredible speeds on our network. So you're now giving people an unlimited hotspot with internet access, and so they can either use the phone, or if they happen to have a device or there's a low income device program, they can get access to a device. Where it really distinguishes itself is the upper part of the phone. Down here on the bottom, if you were to see one, it looks just like a phone. Up here, there's customized apps. So instead of, Facebook and Twitter and, whatever else you've got up there, the apps directly connect the individuals to resources. I have a demo phone, but I didn't bring it with me today. But, I'm going to operationalize this a second so you guys can really wrap your head around what I'm talking about. We've got a project that we're working on with the Oregon Youth Authority. It launched about 1.5 years ago. When I was talking to the director of the Youth Authority, one of the things he told me is the number one reason people go back into the authority is not because they've committed a second violation. It's because they've missed their court date or they've missed their meeting with their probation officer. Well, that's a communications failure. And a lot of these are, lower income who may not have access to a smartphone. They're getting a smartphone with customized apps that directly connect them to the court system. So it's not like, oh, well, just use the internet or rely on getting an email. You get an app that says courts, an app that says probation, job training, if they're, school, GED, whatever. And so, they're already finding that very successful. They've expanded the program, to include more kids. It also gives them a digital identity, as we discussed earlier. They get to keep that phone number. And so now, if you've filled out a job application and then you lose your phone number because you couldn't pay the bill, well, they're just going to go down that list and somebody else is going to get the job. The other one that I'll talk about briefly, and we've done this around the country. It's not just onesies and twosies, but it hasn't taken off like I think it should and will going into the future. The Washington Department of Veterans Affairs has about 1,700 veterans, low-income veterans, who also utilize the resource. In that case, it comes with Google Meets. So if you're transportation challenged and you need to talk to somebody, you don't have to get on a bus. You can just, have a video chat. And the apps there are, apprenticeship by industry, women's resources, traumatic brain injury, and the apps aren't put on by T-Mobile. We actually facilitate the putting on of the apps, but they're told what is put on is dictated by the department. So essentially, instead of saying, hey, come to the department and we'll hook you up, it's okay. We recognize that you're probably not going to get down here. And we recognize that you may not have a computing device where you're not going to be able to connect to those resources. So we're going to give you a device, and it's very inexpensive. We're giving, they're fine phones, but it's $30 a month, includes the phone number, the service, and the kitting. And so I think that's the future of e-government. The future of e-government is recognizing that the people who utilize government services the most are the least likely to have the digital literacy skills, the connectivity, and the devices. And so I think there's efficiencies to be gained from government by recognizing that and providing those devices. It costs anywhere between $1,200 and $2,200 just to walk into an emergency room and be seen. So what if you could use this device to get access to resources that will help prevent your condition from becoming emergent? What if you don't have any other recourse, so you go to an emergency room, but really it wasn't necessary and you could have used this instead? I actually legitimately had to go to the emergency room recently, and I have good insurance, and my bill was like $4,000. And so, these are just, you start looking and say, okay, well, if you give people access to the resources in a way that Juliana, that they can access it. We're not just telling them about it and saying, good luck, hoping you hear. So I'm curious what you guys think about that concept. Are there pitfalls that I'm missing as individuals? If I told you, hey, the government is now providing low income, thousands and thousands of low income people are getting smartphones. Isn't that outrageous? What do you think, Juliana?
Well, yeah, definitely. Looking from the access standpoint, it makes sense. You have a tool, it's cost effective, it connects the services that you might need most. I think going back to what Laura said earlier, we had to be concerned with privacy, particularly with in terms of education attainment, and we have special populations. We just had to be careful that the information, the privacy is still taken seriously. We have so many examples of historically how special populations also were taken advantage of. And especially now with AI, in some sense, the more I know through technology, the more I collect information from an individual that could aid AI, that could help us have more inclusiveness when it comes to the AI prompts and generation, because we
I'm so
do
glad to hear you say
acknowledge
that. I'm
AI
sorry to cut
bias.
you off, Juliana, but I am so glad to hear you say that. I've said the same thing, and so many people are afraid of AI. I think it could really be I mean, obviously, there's reasons to be afraid, but I also think it could be a benefit in just the way you talked.
It can be, yeah, it could help eliminate bias because now you are taking information in. So we democratize information in terms of the database of knowledge and intelligence that AI is using. But at the same time, I'm cautious with the notion of privacy, and how this whole thing of controlling individuals, because especially with the iPhones and talking about T-Mobile and Samsung. I have an iPhone, and one thing that led me to iPhone and why I keep the iPhone for years, I was an early adopter of iPhones, is the privacy. um, I feel that the iPhone protects me even when I interact with technology, social media. iPhone gives the option to use an alias when I'm signing up for services, so they don't know who I really am. And so having this government or this government funded phone does create concerns. But I think it can, on the other hand, it can also help eliminate bias, because now we are also contributing information to this database of intelligence as is being produced, with AI growth.
I think I certainly hear you, and I think you're right. There are, those privacy concerns are real. So far, what we've seen, is the people who are getting these are so grateful to get them because they don't have it. As I say, it's a tool, not a toy. And so they're grateful to have this tool. And there's steps to make sure, it's got mobile device management, so they're not downloading things that might, put them at a security risk or a privacy risk inadvertently. There's no app stores on these things. It really is a tool, but the level of gratitude, that we're seeing, and in some of the anecdotes, the transformation, it's a trade-off. Yeah, I mean, you're getting a phone from the government, but it's not, nobody's required to take it. We're not requiring the population at large. The government is generally looking at it as, look, we've passed all these benefits. We did it because we want people to get them, and this is a way to do it. I'm going to ask one more
And
question, and I realized,
Sorry,
Dinar?
lights just went off. They're like motion sensor. One moment.
Oh yeah, wave an arm in the air and it'll go back on. I was going to ask Dinara, the final question here, because I looked at the time and realized we're kind of, running a little late. You told me in the beginning that you read the chapter thoroughly and you're really, you're very well versed in it. What are your just general thoughts on the chapter? And then do you have any questions for the three of us from your perspective? As I said, I think this chapter, we talk about Generation T, we talk about technology. Like, what did you think of the chapter? And I'm not looking for plaudits. I just like critically, what did you think of the chapter conceptually? And then do you have any questions for us?
Yeah, of course. If it's all right, could I answer your other question about the government phones?
Yeah,
Yeah.
absolutely. And then we can run a little long on that. Sure, go ahead.
Yeah, thank you. I thought it was really interesting, from just a different perspective. This summer I'm getting the chance to intern for an organization that serves as a legal orientation provider for detainees in any ICE detention centers. And just the idea of them having something, maybe not like a personal device, but at least the center having some sort of place where they can retrieve any sort of legal information, because on our end, they are standing at an old payphone, and the best we can do is verbally tell them what their options are, or have them wait over 10 days or almost 2 weeks to receive a physical packet of this information. And not like them not having that right in that moment makes it so much more difficult for them to go forward. And there are so many other confounding concerns with ICE detention centers, that there's so many things that they just aren't able to do. And a majority of them are low income and they don't have the money to pay for a private attorney. Then how are they going and finding pro bono attorneys? That's us providing that information. But if they had something in the detention centers to at least access something, I feel like that would be make a world's difference for these people who are struggling so much, especially for the populations that are seeking asylum or interested in withholding of removal or Convention Against Torture. Those applications take time and forms, and you really need to understand the information. And even like some of the things that we do is find country conditions and learn about the quality of the country so that they can provide it to a judge and say, hey, this is the reason I cannot go back. Like, I'm going to face either prosecution or torture going back because of either any affinity groups I'm a part of or just my ethnicity or anything like that. So I feel like from that perspective, having something like that is so, so large. But also I understand Dr. Trammel's comment about the privacy and things like that, because it is a bit like, especially for general population, that is like a bit of a concern.
Well, yeah, and I hear that concern. I personally would have problems if the government came to me and said, "Here's your cell phone, you're required to use it."
Mhm.
We're talking about, low income, vulnerable populations who don't have the device. I want to be clear to people who are listening. We're talking about a way of providing connectivity between government resources and individuals with the hope of transitioning them to where they don't need those resources. So let's have you answer the question of, so kind of you from your perspective, which is very different from ours, and valid, but just very, very different. The three of us, are a lot more alike in where we are in our stages of life. Not that I'm calling us old guys, but and so what did you think of this chapter that really is in some ways kind of about, at least maybe not you specifically, but your age group generally? And then do you have any questions for us?
I think the chapter was really insightful. I think it, like, as someone who's grown up just always having technology, and also very fortunate to have a family that was financially stable enough to provide me and my brother with technology, it was kind of eye-opening to see how drastic our lives could have been if there wasn't access to technology. And I feel like some of the questions I had were a little bit related to kind of what you all see the government being able to do. Like, I think the like phones, or like the phones for individuals was interesting, but is there something that like other countries are doing that like the US could implement? Because I feel like this entire time we were really focusing on the US. This is a little bit out of the scope, but I know the US is usually a driver of like things with innovation and things like that. But I think there are other countries that could be doing something different that maybe we can adopt from them. But for any of y'all, do you think there's someone that's doing it better than how we are, and like really getting their community involved with technology and making it more accessible?
Lloyd, can I offer thoughts on that?
I have thoughts too, but you go first.
All right. So I think the U.S. is a very unique situation because of our federal government. So it's very difficult to compare that to governments that are more centralized with services. So the first thing I'd say is, especially with educational systems, because we have local educational authorities that make micro decisions, you can take that with all sorts of carceral systems and everything else. The other thing is, I would say, is resources travel in packs. So when there's a government service that provides resources, take the case of Scandinavia, it's going to be part of a parcel of holistic care that the government provides, from healthcare to internet access. So often in the US, I think we try and disaggregate these things in our understanding, and maybe that's because this idea of federal authority is pushing our conceptualization. So I would say, if you want success stories, look at Scandinavia, but then be aware that it's a meta orientation to government's role in providing services. So I know this is the last thing I'm going to say, but I want to really say the importance of these public-private partnerships, like what Lloyd is doing with T-Mobile. I think that's the answer. Government, I am sorry to say, is not nimble enough. And I'm going back to this interview I was seeing with Obama, and he was saying there is no talent divide between private and governmental. There's a resource divide. And I do think these partnerships are the way forward. And I think one of the things that is so important to do is also to question assumptions about who we're serving. So we were talking about commuter students. It's even worse than I thought. I looked up some quick stats. 85% of all college students nationwide don't live on campus. 40% of commuter students at UCLA drive over an hour to get to campus. UC Riverside, 70% of students don't live on campus. Mm-hmm. So I think we need to really think about our assumptions about these end users. And that's why I think what Lloyd is doing with T-Mobile is so important, because Lloyd, everything you described takes the needs of the user and fits the technology to those needs, rather than saying, oh, here's what we think you need, and giving it to somebody. So I want to thank you for the opportunity to participate and hand the floor back to everybody else.
I appreciate that, Laura. So I'm going to kind of answer your question. There's no one lock, stock, and barrel like, hey, let's pick it up and implement it here. And for a myriad of reasons, a couple of things immediately leap to mind of where there are some interesting best practices. Estonia is the most technologically advanced country in the world. And whenever I tell people that, they scratch their head and look at me and go, I didn't even know Estonia was a country. But Estonia is the most technologically advanced country in the world. It's also a very new country, relatively small in terms of its physical size. So, here we are, some of us are thousands of miles from our central government. They're all very close. It's a small population, right around 2 million, and very homogenous. But, you could still take what they've done with their eStonia project and apply those lessons here. In Africa and the Middle East, in countries there, multiple countries with multiple solutions, they actually utilize their cell phones for banking and not in a Google Wallet sort of way. So it helps the unbanked. I don't know if that's something you're familiar with, but people who don't have access to banking because they're not able to, for whatever reason, access the banking infrastructure of their country, utilization of cell phone technologies, which they can utilize them as banking. Instead of, they can make deposits. I have T-Mobile. I can't make a deposit into my T-Mobile, bank account, but there's programs like M-Pesa and some of the others where it's the mobile phone is a banking application, and that could be an interesting way of providing banking to unbanked individuals in America as well. And then the last thing I'll say, Laura, you're very right. They're, disaggregated. You've got, in California, we've got 485 cities, 58 counties, 900 and something school districts. And I have no idea how many special districts. Special districts are anything from the Sacramento Municipal Utility District here to the Mosquito Abatement District to the flood control, all of those. And the challenge is, there might be a government building with some things co-located, but most government entities do their thing. Like, this is my thing. Mm-hmm. That's my thing over here. But websites aren't their thing. Websites are their thing, but they can be aggregated. And so that's an area where, and I think, I don't necessarily think that with CPR3, some of these states have really gone as far as they could in aggregating the benefits. They're aggregating benefits for specific target populations, but you could aggregate websites, and that's where you could really start to transcend the boundaries of one governmental organization, one government geography to the next government geography to the next government geography. And then you could also, because it is, computer technology, you could solve the problem of, calling in, oh, no, that's a county issue. Oh, okay. Oh, no, that's oh, I'm sorry. It's digitally sorts you based on whatever number of factors. And so you're talking to the right people, you're streamlining the number of interactions you have to have. So I think, kind of going back to kind of where we finished in terms of e-government services, starting at the beginning, looking at Twitter to, is it possible to look at this new model? And I think it is. And I think there's multiple benefits for doing that. To answer your question, Dinara, yeah, I think that is a way of achieving some of that same effect. So we're definitely out of time here. We've gone way over time, actually, but I've really enjoyed the conversation with all of you. Dinara, thank you so much for joining us. I obviously I love all of our UC Riverside students. I think we have no offense, guys, but I think we have the best students, in the world. And so also, just thank you for your perspective. Really appreciate your contributions to this. Juliana, Laura, thank you so much for working on this chapter with me, this book with me. Greatly appreciate it. And thank you both for appearing on the podcast. I love this. Again, as I've said, for those of you who've made it all the way this far, this is not a summary or duplication of the book. This is derivative. We use the chapter as a launching pad. Please go back and read the chapter to learn more. Join us next time as we continue the conversation, and we're looking at technology as it relates to healthcare, the delivery of healthcare. Some of these same issues are going to come up. The digital divide, as I talk about at the beginning of that chapter, when you generally think of telemedicine, you think of whiz-bang scanners and all these futuristic things, but that's not really where the beginning of telemedicine is. We look at the different ways technologically disenfranchised individuals are impacted and what government could do to improve healthcare outcomes. So join us for that next time. And once again, this episode is dedicated to my cousin, Barry Wellman. Barry, miss you, love you. Thank you for everything. Thank you for joining us. Look forward to talking to everyone next time. For this episode and the entire Technology versus Government podcast series, special thank you to the UC Riverside School of Public Policy for their support. Thank you, too, to Dean Mark Long, whose support of this entire project was essential to its success. A special thank you to the executive producer and the usual host of Policy Chats, Rachel Strassman. Without her diligent hard work, none of this would be possible. Thank you, too, to the Wall Street Journal Higher Education Initiative for supporting the podcast and their effort to spread the word on higher education and technology in government. Thank you to the Policy Chats team of committee members who volunteered to support and produce the Policy Chat series: Divya Bharadwaj, Dinara Godegay, Derek Pedigo, Andrew Shannon, and Veer Sinha. Also, thank you to the team at the Hear Me Now recording studio for their excellent recordings of these podcasts: Jeff Holden, founder and principal, and Sawyer Malam, the technical director. And finally, thank you to Emerald Publishing for allowing me to publish this book that gave rise to the podcast series. Without those individuals, none of this would be possible, and they have my sincerest gratitude.
This podcast is a production of the UC Riverside School of Public Policy, and our theme music was produced by Veer Sinha. For the latest updates on the School of Public Policy, be sure to check us out at UCR_SPP on Instagram, or for more episodes and content, visit our YouTube channel. I'm Rachel Strassman. Till next time.